Well, thank you for the invitation to be here, and thank you for highlighting this very important problem with this workshop. I would like to spend my time talking about two different approaches to the prevention of bullying. The first are efforts to build social competencies within the aggressor bully. This effort might occur individually, one-on-one, with an adult trainer and the individual child, or in groups in which the bullying child is interacting with non-aggressive peers, or third, in deviant peer-only groups in which aggressors and bullies are placed with other aggressors and bullies to try to try to complete intervention. The second kind of approach are efforts to work with the peer environment and culture to reduce the reinforcement of bullying. A little bit of background first on peer-focused interventions. The technology to build social skills that will help an individual child refrain from bullying and aggression has really improved dramatically over the last couple of decades. There are many interventions: cognitive behavioral therapies, cognitive behavioral skills building interventions, social skills building interventions, social problem solving training, all different kinds of interventions that have proven efficacious. But most of public policy and most of the programs and most of the interventions are not individual skill building with children. Rather, the most common way that we deal with a bully or with an aggressive child or a deviant child is to place that deviant child with deviant peers systematically in interventions. We do this in many different spheres. We do it in mental health through group therapies, Mayu therapies. When we reviewed this literature a good number of years ago, at that time, over half of the expenditures in the mental health arena for aggressive behavior were completed in groups, over $6 billion a year at that time. We do this in education through tracking children, maybe tracking by academic skills, but that might be a proxy for aggressive behavior as well. We do it in special education, placing behavior problem children with other behavior problem children in self-contained classrooms, or at least for part of the day. We do it in in-school suspensions, which are increasingly popular, where all of the deviant children are placed with each other and segregated from everybody else in the school building. And we do it in alternative schools, where we take them out of the school completely and place them in alternative schools with other deviant children. We do it in juvenile justice through placing deviant delinquents in training schools, boot camps, incarceration. 93% of the expenditures in juvenile justice are group-based kinds of interventions for $5 billion a year. So it's our most common public policy for dealing with aggression and bullying, I think. There is a rationale for peer group interventions, either intervening with the entire peer group or intervening with deviant children in deviant peer group placements. There is a rationale for it. It's less costly. It does afford the opportunity for role playing and practice, which might actually help some skill building. It is a way to manipulate that peer group reinforcement of aggression, following from the kind of work that Tom Deshawn was describing. Anecdotally, clinical experience suggests that some aggressive children feel more comfortable in groups rather than being confronted individually. And certainly group intervention where problem individuals come together with other like problem individuals is common in our culture. Look at Alcoholics Anonymous, AA, and that kind of intervention. So there's a history and a rationale for this. However, when one reviews the literature, so Mark Lipsey has reviewed the literature on peer-focused interventions, say in juvenile justice, he finds intervention efficacy is generally positive, although overall modest effect sizes. Now this average effect size in juvenile justice, modestly at 0.10, aggregates across a whole range of individual interventions, with some of them cognitive behavioral interventions specifically having larger effect sizes than that. But there is a general positive effect size for improving individual behavior. However, on average, those same kinds of interventions, at least those same theories of intervention and models of intervention, when administered or implemented in a peer group setting are about 1/3 less effective. The average effect size goes down by 1/3. Furthermore, Mark finds that many group interventions, peer group interventions, actually yield net adverse effects. So now we're getting into the realm of iatrogenic, actually harmful effects, where what we do systematically may actually harm children. About 42% of the prevention programs he reviewed yielded net adverse effects, and 22% of probation programs even yielded net adverse effects. So he concludes that individual interventions are more effective and more cost beneficial. I've put together his findings in an informal model, generalized findings about peer-focused interventions to reduce bullying. Perhaps might be characterized in this graphic form, where the yellow bars are the impact or our change over time among control group non-treated individuals is a negative impact and a decline in their behavior, that is a growth in their aggressive deviant behavior without intervention at all. But the red bars are the intervention groups, and individual interventions yield net change in a positive direction. When administered in a group, it's still a positive effect, less strong, but when implemented in deviant groups, sometimes there's a net negative or adverse kind of effect. That literature that Mark reviewed and that mostly exists has a particular problem. That is, programs are being compared across studies. And so the participants are different, the interventionists are different, the settings are different. You're really comparing different contexts altogether. So really there hasn't been a random assignment experimental test of a particular intervention, whether it's administered as individually or in peer group contexts. And so colleagues John Lockman and Tom Deshawn and others are involved in have devised, developed, and implemented an experimental test of individual versus deviant peer group administration now with the intervention called Coping Power. Coping Power is developed by John Lockman. It's an individual social cognitive skill building intervention for 8 to 14-year-old aggressive children. So in this study, they identified 360 aggressive fourth grade children in schools, 20 different schools, that they randomly assigned at the school level to receive Coping Power, either individually delivered Coping Power program, ICP, or group delivered Coping Power. Now these are deviant peer only groups, right, where only the aggressive children, fourth graders, are brought together, with their measurements pre-intervention, post-intervention, and at 1-year follow-up. I read what they have put together, and they're still tracking children and assembling findings, but my understanding is that at immediate post-treatment, the findings are a bit mixed, some positive findings, some null findings, some negative findings, and there's a tendency that I would call a tendency for homogenization. Now, homogenization is a phenomenon in peer groups in which these are all aggressive children, but among all aggressive children, the most highly aggressive children become less aggressive, and the less aggressive children become more aggressive. So there's a tendency for peers to influence each other toward a mean and to narrow the range of aggressive behavior within that group. There is divergence in their findings at 1-year follow-up, depicted in these slides that I've borrowed with their permission. So on the left side, you see 1-year impact of individual versus deviant peer group administration of Coping Power on teacher-rated externalizing problems. Both groups show a decline in aggressive behavior over time, although the group-administered Coping Power is in the yellow bar, and the decline is really not different from 0. So there's no efficacy. But the efficacy of the individually administered Coping Power is hefty in that the bar shows a decline of quite a few points, 16 points on their externalizing problems scale scores, or raw scores, I believe. Likewise, on the internalizing problems on the right side, you see less strong an effect, but nonetheless an effect on reducing even internalizing problems for the individually administered group. So that's first experimental evidence of perhaps the difference. and the superiority of individually administered versus deviant group administration. That may not be possible all the time to administer interventions individually, and so there's a literature on ways to mitigate iatrogenic effects of deviant peer groups. If interventions are administered in deviant peer groups, these factors have been found through correlational studies mostly to mitigate the deviant peer group effects. Strong training for experienced adult group leaders, using behavioral reinforcement strategies systematically, and teaching strategies that emphasize clear instructions and emphasize a peer culture norm of non-deviance, limiting the unstructured time with peers, and then outside of that peer group intervention context, monitoring hotspots where peers congregate, and even limiting the interaction opportunities of the peer group members by perhaps mixing children from different schools so they may come together during that intervention time, but they don't interact outside of the peer group, or even different communities. And certainly this is more and more common for children in the juvenile justice system where they're incarcerated. And a short duration. Don't put them together for very long. All right, let me shift to the second approach of changing the peer culture to reduce peer bullying. Two kinds of approaches I want to note. First is positive behavior intervention that supports PBIS. I'm not going to talk about it at all because there's a true expert in the room. Catherine Bradshaw has done some of the most elegant, best randomized controlled trials. One citation at the bottom of a recent study of hers. She knows far more about it than I do, about its very promising effects. What I will highlight a little bit more is by Tom Farmer recently, the Supporting Early Adolescent Learning and Social Success SEALS model, which is a teacher training model and directed consultation to help teachers with social dynamics management, enhancing academic engagement, and enhancing their skills at classroom behavior management. So Tom's involved, created a randomized trial of SEALs at 28 middle schools, randomly assigned to receive the SEALs teacher training intervention or a control. And there's a number of findings so far. This is ongoing. Teachers trained in this SEALs intervention are more accurate at understanding peer affiliations. They become better managers of the classroom. Their students make greater academic achievement gains. The students report valuing school more and feel more belongingness in the school. They report more supportive school and peer context. And they interact more with more normative peers rather than just other academic peers. One finding I've been looking for, I haven't seen yet, is there a reduction in bullying or aggression? And I think that's still being evaluated and maybe more complicated. I'm going to conclude with 4 recommendations, real simple, straightforward, but important recommendations, I believe. First, ineffective programs, placements, and treatments that aggregate deviant peers for the purpose of doing these interventions should be avoided whenever possible. By that I mean training schools, boot camp, scared straight, guided group interaction, gang resistance education and training program that Tom alluded to a little bit, midnight basketball hangouts, non-structured after-school programs, highly structured after-school programs may well be very positive and very efficacious, also depending on who's in those groups. Second recommendation, effective alternatives are out there and should be encouraged. Individual therapies that have been referred to earlier this morning, whether it's functional family therapy, multi-systemic therapy, multidimensional treatment foster care, therapeutic courts, early prevention programs and discipline practices before kids develop this way, like high-scope preschool, fast-track lift, programs that do combine high and low-risk youths. Groups are not bad, it's how they're constituted. 4-H school-based extracurriculars, boys and girls clubs, as was referred to earlier, scouts, church activities, and universal peer culture interventions like PBIS, like SEALs, for older kids, Job Corps, individual skills training, and as Tom says, efforts to disperse rather than increase gang cohesiveness. Third recommendation is when placement appears as inevitable, specific measures should be implemented to minimize its impact. Avoid placing highly susceptible youth. We know that some individuals are more susceptible, slightly deviant, younger than their peers. We should avoid placing deviant youths with older, more deviant peers or peers with similar problems from the same community. employ experienced leaders, provide training, create highly structured environments with little free time, monitoring their behavior closely and keeping the placements to short duration. And finally, the last recommendation is in reviewing this literature, it's very interesting how little is documented in the reports of programs about who is in the peer group when a group intervention is being implemented. So practitioners, programs, and policymakers should document these placements and evaluate the impacts of these placements. So the record, whether it's a clinical record or a research record, should include a description of that placement environment, who's in that environment, what kinds of peers, not just peers, but what kinds of peers, description of those peers, and then to evaluate the impact. With that, I'll open it up. Thank you.